The Mental Health Rehabilitation Center in the Ministry of Health, Wellness and the Environment hosted a symposium dubbed mhGAP Reintegration of Mental Health into Primary Care. The World Health Organization Mental Health Gap Action Program aimed at scaling up services for mental, neurological and substance use disorders for countries especially low and middle income. The program asserted that with proper care, psychosocial assistance, and medication, tens of thousands could be treated for depression, schizophrenia, and epilepsy, and prevented from suicide and begin to lead normal lives even when resources are scarce. Mental, neurological, and substance use disorders are common in all regions of the world, affecting every community, age group, from all incomes. While 14% of the global burden of disease is attributed to these disorders, most of the people, 75% in many low-income countries, do not have the access to the treatment they need. The topics addressed at the symposium included depression, psychosis, epilepsy, dementia, schizophrenia, developmental disorders, behavioral disorders, the monitoring and evaluation of these areas, principles of care, and the role of the district medical officer and doctor in the reintegration process, the role of the nurse and A&E physician in the reintegration process, steps and barriers to implementation, de-escalation skills, and referral protocols. The positive dimensions of mental health was stressed in the WHO definition of health as contained in its constitution. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The benefits of reintegrating mental health into primary health care are significant, as it ensures the population as a whole has access to the mental health care they need in the early course of disorders and without disruptions, and this is primarily what the symposium addressed. Here are highlights from the symposium.
As we continue with our proceedings, I would like to ask to the podium our Chief Nursing Officer, Peggy De Silva, to offer opening remarks.
Mental health is integral and essential component of health. The World Health Organization, WHO Constitution states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. An important implication of this definition is that mental health is more than just the absence of mental disorders or disabilities. It is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make a contribution to his or her community. Mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. On this basis, the promotion, protection, and restoration of mental health can be regarded as a vital concern to all. In 2013, the World Health Assembly approved a comprehensive mental health action plan for 2013-2020. The plan is committed by all WHO's member states to take specific actions to improve mental health and contribute to the attainment of the set of goals according to the global targets. The action plan's overall goal is to promote mental well-being, prevent mental disorders, provide care, enhance recovery, promote human rights, and reduce the mortality, morbidity, and disability for persons with mental disorders. It focuses on 4 objectives. They are: 1, strengthen effective leadership and governance for mental health, provide comprehensive, integrated, and responsive mental health and social care services in community-based settings, implement strategies for the promotion and prevention of mental health, and strengthen information systems, evidence, and research for mental health. Particular emphasis is given in the action plan to the protection and promotion of human rights, the strengthening and empowering of civil society, and the central place of community-based care. One of the key strategies instituted by WHO is scaling up through the Mental Health Gap Action Plan, or the mhGAP. The mhGAP contains a set of clear, coherent activities and programs for scaling up care for mental health. This program is grounded on the best available scientific and epidemiological evidence on priority conditions. It attempts to deliver an integrated package of interventions and takes into account existing and possible barriers to scaling up care. It is with this backdrop and commitment that the leaders of the mental health services at the Mental Health Center set about to achieve, as one of the ministry's mandates, the integration of mental health into primary health care. For this, they must be commended. I would like to particularly commend Sister Elizabeth Medford for taking the lead in continuing this process. Sister Medford plunged straight into it from the get-go, from the very moment she was assigned to the Mental Health Center in administrative control. Sister Medford now holds a post of Senior Nursing Officer in an active capacity, and she is making significant positive impact. We can all attest to that. The integration of mental health services into primary health care is, of course, a process. It has tremendous benefits to the patient, caregivers, society, the community, and of course, the country as a whole. Evidence has shown that, 1, integration is most successful when mental health is incorporated into health policy and legislative frameworks and supported by senior leadership, adequate resources, and ongoing governance. It also shows that integrating mental health services into primary health care is the most viable way of closing the treatment gap and ensuring that people get the mental health care that they so need and deserve. It also shows that primary care for mental health is affordable and investments can bring tremendous important benefits. Evidence also shows that certain skills and competencies are required to effectively assess, diagnose, treat, support, and refer people with mental disorders. It is essential that primary care workers are adequately prepared and supported in their mental health work. Evidence also shows that to be fully effective and efficient, primary care for mental health must be coordinated with a network of services at different levels of care and complemented by broader health systems development. Successful integration therefore requires collective efforts. It requires that we work collectively and collaboratively to effect positive changes, hence our presence here today. I applaud you for attending, and it is our desire that you dedicate your full attention to the presentations and participate actively as we endeavor to continue to strengthen and scale up our response to mental health and in moving our mandate from page to stage, working towards improving the mental health of the population of St. Vincent and the Grenadines. Thank you very much and best wishes for a successful working session.
Today marks a very happy and important day for mental health services in St. Vincent and the Grenadines as we recommence the journey of the implementation of the mhGAP for reintegration of mental health into primary care. Special thanks to the government of St. Vincent and the Grenadines, the Ministry of Health, Wellness and the Environment, PAHO, our Chief Nursing Officer, Sister Peggy De Silva, the steering committee, and the highly motivated and committed multidisciplinary staff of Mental Health Rehabilitation Center, who has worked relentlessly to make this day a reality. Mental, neurological, and substance use disorders are common in all regions of the world, affecting every community and age group across all income countries. While 14% of the global burden of disease is attributed to these disorders, most of the people affected, 75% in many low-income countries, do not have access to the treatment they need. The World Health Organization Mental Health Gap Action Program, which is referred to as the mhGAP, aims at scaling up services for mental, neurological, and substance use disorders for countries, especially with low and middle income. The program asserts that with proper care, psychosocial assistance, and medication, tens of millions can be treated for depression, schizophrenia, and epilepsy, prevented from suicide, and begin to live normal lives, even where resources are scarce. The benefits of integrating mental health into primary health care are significant. On one hand, integration ensures that the population as a whole has access to the mental health care that they need early in the course of disorders and without disruption. On the other hand, when people receive treatment in primary health care facilities, the likelihood of better health outcomes and even full recovery, as well as maintained social integration, is increased. We have heard the cry of our mentally ill patients across our land, and we are echoing back the answer that help is on the way and coming right where you are. The stigma and discrimination attached to mental illness will be eradicated, and in every health district across St. Vincent, care will be available with equity and expertise. We thank all our participants for coming on board to ensure that there's a smooth transition of mental health into primary care. Mental Health Rehabilitation Center is determined to leave no stones unturned in its quest to bring every hand on board in our integration process. Over the past year, we have conducted 4 health fairs, 4 open house days at Mental Health Rehabilitation Center, 4 cantatas and exhibition, 1 Bring a Friend a Flower on last Valentine's Day. We have trained 37 police officers in de-escalation skills and 27 prison officers in care of the mentally ill in the prison system. Our health fairs continue monthly in different communities. Our symposium last year on Mental Health Day, dealing with mental health in the workplace, has been very impactful as spin-off workshops at different workplaces, both government and non-governmental, is still ongoing with a total of 11 workshops already completed. Coming on stream is a workshop for family and friends of the mentally ill with an objective of building the social support in the home and community to allow our mentally ill patient to remain well and functional. I mention all of this to bring home the point that significant groundwork is already done at the community level and will complement what we are doing here today. I ask today that this be not just another workshop. The success of this integration process depends on you. I hope and pray that as you leave here today, tomorrow, you'll begin to implement what you have learned. The success really depends on you. Do have a very productive day. As we say, goodbye to stigma, goodbye to discrimination, goodbye to inaccessibility of mental health care, goodbye to the myths associated with mental illness, as we embrace this very special journey of integration of mental health into primary care. Remember, mental health is a shared responsibility, and there is no health without mental health.
I'm very happy that we are at the point of having this symposium today. I am grateful that we have appropriate partners in this exercise, one stalwart partner of the health sector over years, and that is not changing at all, and I don't foresee it to change. It's the Pan American Health Organization, and they are also involved making this possible. So thanks from the bottom of our hearts to PAHO. Now, well, you might see that I'm wearing a green shirt. I hope that you just excuse my green. I know the color, pardon?
Mental health color.
Oh, it's a mental health color? Well, well I'm dressed appropriately.
Yes,
Now, when we have a symposium like this, what we are saying essentially, or what we're doing, is giving life to the fundamental tenet that persons who have mental health issues, conditions, problems are human beings too. And as human beings, they have rights. And the fact that they have that particular problem does not mean that their ability to live as normal a life as possible should be unduly restricted. And in order to allow them to live that normal life within the context of their own condition, we are going to take some positive steps as a ministry this morning, and this is a very important positive step. Because when we talk about the reintegration of mental health into primary health care, we are simply saying that we want to take this matter closer to the communities. We want to take this matter closer to the homes of the persons affected. And when we do that, it immediately comes to mind that there are significant benefits to be derived by that approach. We have greater access, for instance, and someone who might have had to, and we sometimes may take the simpler elements of the equation for granted. Even a simple matter such as finding transportation to the place where you might need to be for treatment. That could impinge on the access of care to a person who needs it. So we're going to have greater access. And there are many other things with it as well. When persons have to go to the Mental Health Rehabilitation Center, especially for routine checkups, that contributes to the stigma associated with their particular problem. Because it seems as if they need some sort of special treatment, whereas persons who might have a flu, a common cold, or some other ailment could simply go to a clinic in their community. So we're going to take all that away. And ultimately, as Sister Medford so eloquently said when she spoke, this is about the pursuit of better health outcomes for the patients. The evidence is abundantly clear that when patients could access mental health services in their communities, they have better health outcomes. And that is the overarching goal that we have set our eyes on, and which brings us together around these tables in this conference room this morning. So let us never lose sight of that overarching goal. And if we're going to be effective in delivering mental health services in our communities, it is clear that we're going to need training opportunities. We need to train persons who are relevant to the health services in the district. And this is essentially the launch of a training program. And I have seen that it's going to be done in 4 phases, tackling different health centers, including the Milton Cato Memorial Hospital, the different wards, and tackling different personnel. So we're going to have the coverage of the health centers, we're going to have the coverage of personnel, and we're going to thereby build capacity that would help us to be more effective in what we want to do. Now, the point must be made that the government of St. Vincent and the Grenadines and the Ministry of Health, Wellness and the Environment is not taking, however, a one-track approach to addressing issues concerning mental health. We don't believe that we could have training and we could build capacity and then we should pat ourselves on the back and think that the job is done. No. And that is why, and I've been in recent contact with Sister Medford on this particular point, we have to see how we could activate some of the current provisions of the Mental Health Act. to begin with, because there's some things in there that would help us to make progress along the road to doing our best for our mental health patients. But beyond the activation of some of those provisions, we have to look down the road to new legislation. You would realize that we have been taking a multi-pronged approach to this issue. Recently, not so long ago, I think in 2016, which seems a little while ago now, we were able to open the new Mental Health Rehabilitation Center, renovated at a cost of over 4 million EC under the modernization of the health sector project. Now, we are looking to put some emphasis on training, and we've done other things as well. Sister Medford has highlighted some of the things that have taken place in the recent past and some plans for the future, but we're doing training here now. And then we're looking to put our protection of the human rights of mental health patients on a sound legislative footing. So you would see that we are taking a multi-pronged approach to this issue. And I made the point about the considerable benefits associated with getting our patients treated in their communities, about making the treatment more accessible to them where they live and work and play and have their families. And I just wanted to end off these remarks by reading a paragraph which I think aptly encapsulates all that I would like to say along these lines. One, it allows us to provide more holistic care for mentally ill patients who are often comorbid with many other physical health problems such as cancer, HIV, AIDS, diabetes, tuberculosis, among others, and will be able to access this care at the community level. So a mental problem might not be your only problem. You have other problems that should be attended to. When you go to a specialized institution like the Mental Health Rehabilitation Center, you're going to only basically be able to receive the specialist care in relation to the mental health. But now, the fruits of this exercise would make a different scenario altogether possible. Moreover, the relationship between the mentally ill and the care providers will be significantly resolved, as that primary care practitioner are in the unique position of providing care throughout people's life cycle and for different ailments, from birth until death. Treatment in the primary care setting allows for continuity of care beyond the mere one-off consultation and treatment, which is an implication of what I've just said. And the one-off consultation and treatment tends to lead, among other things, to poor adherence to treatment regimes. So we've been spinning top in mud, essentially, because we're not able to really tackle the problem in as a comprehensive a way as possible. But that is going to change as a consequence of this forum. In addition, the fact that people needing care are able to continue living with their families in their communities means that they are more likely to be able to maintain strong links with the society, as well as with sectors that are important to mental health, such as social welfare, education, and labor, all of which are conducive to good mental health outcomes. And I just end by saying that this issue of mental health is something that touches and concerns all of us. We know persons who may have had particular difficulties, and in the course of our own lives, we might be vulnerable to stressors and stress and so on, and we must develop ways of responding to these sort of difficulties appropriately. And very critically too, we should always seek to be ambassadors of good health and live our lives in such a way that, as they say, men would see our good work and glorify the purposes of the Ministry of Health, Wellness, and the Environment. Thank you very much.
Thank you so much, Minister. And just to close off our opening ceremony, just to say that work is continuing